Hello, my name is Tamario Walker. I'm a family nurse practitioner student. I will graduate May 2020, and my research is about hypertension. My research questions is, were patients over the age of 40 with an elevated blood pressure screened outside the clinic before being diagnosed with hypertension? This is my research poster. We will go through introductions and purpose, objectives, methods, student population, the findings, discussion and action plan, and the acknowledgement. As we know, hypertension affects many Americans. According to Granger and Guyton, over 70 million people are diagnosed with hypertension. Healthcare costs was over $45 billion in 2011. The United States Preventive Task Force recommends patients 18 years and older should obtain blood pressure screening. With this project, I plan to determine whether patients over 40 years old with an elevated blood pressure were screened outside the clinic before being diagnosed with hypertension. This study was conducted using random sampling with descriptive statistics to conduct a retrospective chart review at an Eastern Arkansas clinic. A total of 50 charts were selected between January 1st, 2019 and November 15th, 2019. The data collected will include gender, race, age, and if the patient was screened outside the clinic before being diagnosed with hypertension. Inclusion criteria included patients that were 40 and older, male or female, diagnosed with hypertension. Also, inclusion criteria will consist of adults over the age of 40 with a diagnosis of hypertension and with the ICD-10 code of Z01.31, R030, and I10. Exclusion criteria excluded patients under 40 and not hypertensive, and patients without an ICD-10 code of Z01.31, R030, and I10. The data was only collected from the dates of January 1st, 2019, November 15th, 2019. The results of this study showed that 92% of patients were screened outside the clinic before being diagnosed with hypertension at the Eastern Arkansas Clinic. Therefore, over 90% of the clinic's patients are screened outside the clinic. The age range for this aggregate was between 43 and 61 years. The clinic practiced outside monitoring as suggested by the United States Preventive Task Force. The results found in this study are congruent with the results found in the review of the literature, but there are no outcomes to be monitored from this research study. Okay, this is the chart with the demographics. The patients that charts that I saw was white and black. It was 50 charts that I reviewed, and it breaks down into uh, white and black, ages 40 to 49, ages 50 to 60, ages greater than 60, and male and female. So the white patients, it was only 4%. The black patient was 30%. Females, it was 14%. Males, it was 19%. Age greater than 60, it was 1%. Age 50 to 60, it was 11%. And ages 40 to 49, it was 21%. There was a breakdown of the demographics of the patient's chart that I reviewed. Discussion and plan. White coat syndrome was well noted in the discussion with possible blood pressure elevations during patient visits. It is essential that the providers rule out white coat syndrome before considering a diagnosis of hypertension. The results of the study revealed that 46 patients were screened outside the clinic before being diagnosed with hypertension, while 4 patients were diagnosed and treated without outside screening. All 46 patients' blood pressure was greater than a 149/87 on multiple screenings outside the clinic. A 54-year-old Caucasian woman was not screened outside the clinic before being treated. Also, a 47-year-old Black woman was not screened outside the clinic before being diagnosed and treated due to multiple comorbidities. More Black men was being diagnosed with hypertension than any other race or gender. Black males ages 43 and 61 did not get screened before being diagnosed and treated. It was due to possible renal insufficiency, so the patients were started on antihypertensive medication to prevent further injury. Education is very important with pre-hypertension and hypertension patients with constant reinforcement, especially Black males. This research is limited. There is not enough Caucasian patients being seen at this clinic. This research is not generalizable to the public. Acknowledgements. Dr. Christopher Jordan is my advisor. Ms. Otisha Hatley is my clinical instructor.